Sleep apnea is diagnosed by watching what happens to someone's breathing while they sleep. And there are two common studies that we do. The classic study is a complex diagnostic study that's done in a sleep lab. A patient comes, stays overnight. We look at their breathing pattern, their oxygen level, their EEG or brainwave patterns, the muscle strain in the chest and the abdomen, and that's the sort of the gold standard for diagnostic of sleep apnea. Something that's become much more common over the last few years is what's called a home sleep test. It's very specific. If your home sleep test is positive, that means you have sleep apnea. But if your home sleep test is what we would call non-diagnostic, it may just be that it didn't pick up the sleep apnea. So you can do a home test if you really suspect sleep apnea, and then if it's not helpful, then you have to do the in-lab study. The modifiable risk factors for obstructive sleep apnea, by far the most common, is weight. If you can control your weight, your tendency to obstruct will be less prominent, and you're less likely to require aggressive treatment. Not everybody who loses weight, not everybody who's thin, can control their sleep apnea. So even some thin people need treatment, but that is the most common modifiable risk factor. So by far the most common is obstructive sleep apnea. Obstructive sleep apnea is about the same incidence of diabetes, about 18 million Americans. Across the world, it's probably 1 billion people. There is a second type of sleep apnea that we see sometimes. It's much more unusual, called central sleep apnea. That's a very different process in which there's no signal for breathing from the brain down to the breathing apparatus. So obstructive sleep apnea is not really a problem with sleeping. It's a problem with breathing while we sleep. And over the long run, it's associated with some very serious problems. People who have congestive heart failure, about 50% of them will have obstructive sleep apnea. Heart attacks and strokes are much more common, and high blood pressure is very common in patients that have obstructive sleep apnea.